Hello everybody. Bismillahirrahmanirrahim. So as we already solved the part first of this question, which is the question number 13, and which the patient have the chronic hypertension. A 38-year-old woman come to our office for first prenatal visit. So she having chronic hypertension because chronic hypertension in which the systolic blood pressure is more than 140 mm of Hg systolic blood pressure, more than 140 or equal to 140 mm of Hg, and diastolic blood pressure more than or equal to 9 mm of Hg prior to 20 week of gestation. Prior to 20 week of gestation. So this was 20 week of gestation. So this was the diagnosis of the question number 13, part first. But this is the part second. So they are telling that this patient is a greatest risk of which of the following complication. So choice A, fetal heart defect. Choice B, fetal macrosomia. Choice C, fetal neural tube defect. D, placenta icterata. Choice E, polyhydramnios. Choice F, preterm labor. Choice G, preterm premature rupture of the membrane. So if a patient having chronic hypertension, so which of the following here is a correct option? So the choice F is the correct option, preterm labor. Why the choice F is the correct option? Because hypertension is associated with both fetal and maternal morbidity. The risk for preterm labor and other complications may be linked to the increased systemic vascular resistance and arterial stiffness leading to placental association. So why preterm labor? Because the arterial resistance increases too much due to hypertension, increases too much, which causes placental dysfunction, and hence the baby will be delivered at less than 37 week of gestation. So this is preterm delivery. So the choice F is the correct one, preterm delivery. Now come to the choice A. Why the choice A is incorrect? Fetal heart defect. So congenital heart defect are commonly associated with genetic abnormalities, for example, trisomy 21 and Turner syndrome. These are associated with fetal heart defect. Choice B, fetal macrosomia. As we already know that uncontrolled diabetes in pregnancy is a common risk factor for fetal macrosomia. Choice C, fetal neural tube defect. So neural tube defect are associated with genetic syndrome, for example, trisomy 13 and trisomy 18. So come to the choice D, placenta icterata. Why the choice D is the incorrect one, placenta icterata? Because placenta icterata occurs when the placental villi attach to the myometrium. Hypertension is not associated with placenta icterata. Choice E, polyhydramnios. So hypertension is associated with oligohydramnios, not polyhydramnios. But polyhydramnios is commonly associated with poorly controlled diabetes in pregnancy and fetal anomalies that cause structural or functional obstruction of the intestinal tract. For example, esophageal atresia. Come to the choice G. Preterm premature rupture of membrane is the rupture of membrane prior to 37 week of gestation and prior to onset of labor. Hypertension does not increase the risk of preterm premature rupture of the membrane. So here I will revise again. The correct option here is preterm labor. As I explained to you, the increased arterial resistance, which causes placental dysfunction, and hence the baby will be developed with delivered at less than 37 week of gestation.